Let's switch gears and move over to Multnomah County Health Department, just a little bit down the road, so to speak, from our last presenters. Kelsey Young is program supervisor there at Multnomah County Health Department's harm reduction program. She got her Bachelor of Social Work from PSU and started with the Multnomah County Syringe Exchange program there as an undergrad social work intern. She completed a master's degree in public health while she was a psychiatric care coordinator and service coordinator at LifeWorks Northwest. She's been with Multnomah County Harm Reduction Overdose Program ever since and became the program supervisor in December of 2019. Her goal is to give us an overview of that program today and discuss the unique role of syringe service programs and how they can function within a government health department. I'm ready to learn all about it. Go ahead and please give a warm welcome to Kelsey Young.
All right. Thank you, Paul. As Paul said, my name is Kelsey Young, and I am the program supervisor for Multnomah County Health Department Harm Reduction Program. A big part of my role in this program for the last 3 years has been providing technical assistance and support to other counties outside of the metro region to help establish harm reduction programs, really focusing on the naloxone distribution and syringe access for people who are actively using drugs. I have worked with Clatsop County and Washington County to support the implementation of their harm reduction programs in the last few years. And we are now working with some other counties in the coastal area to stand up programs as well. I also provide technical assistance to community-based organizations within our metro area that are looking to incorporate naloxone distribution and other harm reduction strategies into their existing scope of services. So today, this presentation has a few goals. The first one is to understand the role of harm reduction services within public health departments. I'm going to cover the unique role and benefit of harm reduction services within public health. Secondly, we're going to talk about harm reduction services and funding sources. So I will provide an overview of our program and include some of the current funding structures for how we pay for things. And lastly, I'm going to consider some common barriers to implementing services, things that I've seen with other counties in the area, and we'll talk about some different strategies to address community concerns and build community connection. So the first thing, public health role. Public health benefits greatly from incorporating harm reduction approaches and services into our body of work. And I always want to remember and give credit and honor the fact that syringe exchange programs were developed by people who use drugs as a way to keep each other safe, especially in the early HIV epidemic in the 1980s. And over 30 years later, there's still many parts of the United States where syringe programs are illegal. And where programs are legal, such as in Oregon, there still is much stigma and resistance and misinformation. So this slide outlines our role what our program has within the public health system. And number one is because our program directly offers these services in the community, we have this unique opportunity to reduce adverse health outcomes associated with injection drug use at the individual, the program level, and as well as the larger health system and legislative levels. So by offering these direct harm reduction services to people who use drugs in our area, we're able to build trusting relationships with a typically hard to reach and marginalized population. So this trust in the relationship that we develop through providing these services is our ability to engage people in medical care and risk reduction And this is especially important given the increase that we continue to see in HIV, hepatitis C, syphilis, and drug-resistant gonorrhea. So our program's primary mission statement is to prevent the transmission of HIV, hepatitis C, and other infections. And in the more recent years, we've incorporated reducing overdose mortality into our program mission. And the way that we do this is that we offer the supplies and tools that people need immediately to help keep themselves safe. So we're meeting these immediate needs and the tangible needs of people who use drugs in our community. And we're doing it without judgment or stigma or any expectation of sobriety. And this increases our opportunities for real health education, real risk reduction, real conversations. So through this direct service, we also, as a public health organization, collect a lot of data. And the data that we collect in our program can help inform other public health strategies. So that's really a unique role that we have as a public health department. So we collect information on overdose events, overdose risk factors, trends of the drugs people are using in the community. Plus then we have just general service utilization data and then we combine that with some information that we uniquely have access to as a public health department, such as preliminary medical examiner data or STI outbreak or cluster, HIV cluster information. And this helps us guide prompt responses to acute public health needs. So an example of this is our program's role in our regional overdose alert system. We collect a lot of data on naloxone use for people that never engage with EMS or EDs, and this information gives us a better picture of what's happening in the community. So for my last point, this direct communication or direct connection with the population and our ability to collect the data really positions us to coordinate with stakeholders to address these big public health issues in our communities. And as a governmental program, we have a voice and an authority within these established systems, and we are able to guide state and local policy and disease intervention strategies. So that's a little bit on the big picture. Now I'm going to dive more into our program specifically. So quick facts is that Outside In was the first organization to open a syringe exchange in Multnomah County in Portland, and that was in 1989. And Multnomah County Health Department began operating a site then in 1992. Currently, Multnomah County operates 5 days a week, and we offer services at 3 locations. One of those locations we have been at since 1996, and that's our 82nd Avenue field-based site. So something to keep in mind is the impact of COVID on our services. And since March, our need for supplies has really increased at our sites. We immediately went into a different model of services, trying to make sure that people were able to shelter in place as much as possible. And in that first month, our syringe distribution went up 178%. And in the last year, our distribution of naloxone kits has increased 200%. So we've really seen this huge shift in the way we're doing services. I'm going to share with you some pictures of what it looks like. So I'll talk a little bit about each picture. Here on the top, you can see inside our van. And so we bring out 100 cases of syringes to each field-based site And then on the shelving there, we have various supplies, wound care supplies, tourniquets, alcohol wipes. We have cottons that folks use as filters. We have cookers or little mixer dishes that we distribute, as well as sharps containers. We give out safer sex supplies, so condoms and lubricant. And then when we're out at the site, you can see on the far right, this is our 82nd Avenue site. And we bring out 2 program vans. So one is point of service for the syringes and other injection supplies. And then the other van is for our naloxone distribution. So folks generally line up in front of the syringe service van. They'll grab the supplies that they need from there, and then generally folks kind of move over to the naloxone van, pick that up before they head out. At the bottom of the screen, I included a photo of our medical clinic room. So the one fixed indoor location we have is called the Harm Reduction Clinic. That's open 2 days a week from 11 a.m. until 7 p.m. We offer needle exchange, overdose prevention, and really low barrier medical care. And it's really intended for acute medical needs, primarily for our syringe exchange clients, but then we also get a lot of their friends that come in. 70% of the people that we serve identify as houseless or unstably housed. So we're seeing a lot of folks for wound care, abscess care, foot care, and then we do STD testing and treatment, HIV testing, all of that. So this room, they're bigger than a typical medical room, and it is really set up so that our providers have space to do all the various kinds of services that we would do. We schedule our in-person visits for an hour, so people are really able to engage with the multiple needs. This has shifted a little bit with COVID. We integrated telemedicine as an option for people who might have an abscess. They can call, have a video visit or just a phone visit with a provider, and we'll prescribe antibiotics over the phone. Our goal is really to help folks avoid going to the emergency department by addressing their medical needs before it gets there, since most of our clients are not engaged in any kind of primary care. Then at the bottom of the screen, I know it's small, but I have a little photo of what our naloxone kits look like. So we give out the injectable naloxone at our sites. Number one, our folks are not afraid to use the needles to inject, so that's not a barrier. And number two, it is significantly cheaper, and with the scale of our distribution, the cost is really a main driver for why we hand out that type. So now that you have a little bit of a visual, this slide I know is a lot to look at. So I did want to include it though, to be totally transparent about the costs of our program. So I'm gonna highlight the important aspects. This is a supply order for the month of March, just for our Harm Reduction Clinic syringe exchange site. The amount of supplies that we move through in our program, we're one of the largest programs in the country right now. So do not be scared away by the total cost at the bottom there. The number to pay attention to are the prices of the individual items. I think that's most relevant, just to keep in mind how much these items could cost if you did decide to integrate this into your practice, as well as being mindful of the way you have to order things is not always intuitive. So for example, the syringes, like you saw in the picture of the van, come in cases, and each case has 5 individual boxes of 100. So when they're shipped to us, we get a pallet of cases, but when we order it, we have to order by the box. And so that can be a little bit confusing the first time you're trying to place orders, whether it's through McKesson or another medical supply company. So just be really mindful of the prices associated with how they ship it and how you order. Your specific supply costs may be higher or lower than ours. Again, as a government organization, we have certain purchasing contracts where we may be getting discounted rates, or we may have a higher price than what you could get it at. You know, overall, our program has seen a massive shift in the way that people are accessing services since the start of the pandemic. So on the right of the screen, you can see that some of our data, our fiscal years run July 1st through June 30th of each year. So since July 1st of 2020, our average visits per month have decreased, but the average amount of syringes has increased compared to the averages of the previous fiscal year. And this was part of our goal, is to give people additional supplies so that they didn't have to make as many visits to our sites, you know, reducing the risk, because most of our folks are taking public transportation and things like that. And what we've also noticed is that people are often coming on behalf of a larger network, and that has really increased as well. So historically, where, you know, if there was an encampment, 5 people from that encampment might come, to where now what we're seeing a lot more is like they'll send 1 person to pick up supplies on behalf of 10 or 15 people. Here's some graphs. I love graphs. So that red line in the syringes out per month, that shows you the increase in our syringe distribution when the pandemic hit. So that month of March spiked up. April was our highest month. It has sort of leveled out at this new high normal. Fiscal year 22, so that started in July, or fiscal year 21, apologies. That started in July, and we're kind of at this, you know, 800,000 to 1 million syringes a month average that we're distributing through our Multnomah County sites. Wanted to also include with that our distribution of sharps containers. And so this kind of gives you an idea of, we're always giving out sharps containers, and our goal is when someone comes, we want to match the sharps container sizes with the amount of syringes they're taking home. So really encouraging people to store them safely, bring them back to us for safe disposal. In Multnomah County, we, in 2015, started installing syringe drop boxes around town. That program has really grown in the last year. And so that's another low barrier disposal option for people. And we are encouraging people to dispose of their used syringes in those syringe drop boxes in between visits, if that's more convenient for them. So since July, we have distributed 17,686 sharps containers, and we have seen 2,382 individuals at our sites. And we know that about 40% of the time, those people are coming on behalf of themselves as well as a larger network. Here's some more pictures for you. So like I said, the volume of syringes and supplies is massive right now. I get syringes delivered to me by the pallet, and I get the pleasure, me and my team get the pleasure of hauling those in through that little door and putting them in storage rooms inside our offices. We collect about 2,500 gallons of used syringes per month. So when we're out at the site, these pictures on the lower right of your screen, each of those individual containers is 18 gallons. That's what we collect used syringes in at all of our service sites. So we have our participants put their used syringes in there. We will take them however they bring them to us. So sometimes they're loose, intermixed in a backpack. Sometimes they're in a soda bottle or a Gatorade bottle, kitty litter containers. We will accept it no matter what, but again, we do try to get folks to store them in the official biohazard sharps containers. We have the participant place the sharps directly into these 18 gallons. Our team never comes within 2 feet of used syringes. We have some tongs that we bring out to the site. So if anything falls or we need to adjust anything in the container, we always use the tongs, and that's to avoid any accidental needle stick injuries. And so we transport all of that back to our main office at the end of the night. And then we have a contract directly with a biohazard disposal company, and they pick up from us twice per week. So now I'm going to move into some barriers and strategies. This is kind of my final area of focus today. And I want to share these common barriers and some strategies to address these community concerns and build community connection. This is a very brief and general overview, but it can help you possibly think through potential issues if you are at that early stage of wanting to incorporate harm reduction tools into your individual practice or organization, or if you're thinking of expanding. In Multnomah County, we have this well-established program. I recognize that I am in a more progressive metropolitan area, urban environment, and this is not the experience for much of Oregon. We have very limited syringe service programs throughout the state, and through the training and technical assistance work that I have done over the past few years, I've seen some of these common barriers come up. So first off, when you are just beginning, it can often be difficult to determine your scope of services and then generate that buy-in from decision makers within your own organization. So centering the community voice in this process to really understand what your patient and population needs are is going to be crucial, because I think as professionals, we can often make assumptions or apply the information from studies or webinars that we participate in. But I think truly listening to the needs of the people who use drugs in your community will ensure that you're going to be providing a service that will be utilized and make the most impact. So responding to those existing needs will support you in generating buy-in with decision makers. There are decades of research that support the integration of harm reduction model into healthcare, as well as the health benefits of providing access to injection supplies in naloxone. So the evidence is on your side. It's mostly changing the hearts and minds of folks and overcoming some of those fears around cost or political implications. So really using that community voice of the people who live there. Those are community members, those are neighbors, those are family members saying, we need this resource. And their needs are just as valuable as anyone else's in the community. So finding funding is then often the big barrier. Once you have buy-in, you have an idea of what you want to do, getting ready to implement it and finding the funding to pay for it is a challenge. So, one thing when your organization agrees in theory, but the price tag can be daunting. So I just want folks to understand, like, all of us that are doing this work are really engaged and are working at a systems level with groups like Oregon Health Authority and Care Oregon to identify financial support for integration of this work. So reach out to your local public health or your behavioral health departments, see if regional grant opportunities exist. That's always a possibility, especially in the time of COVID. There has been some new funding streams that have opened up, new projects that have started, and it never hurts to start there and asking for what's available. if you're a medical provider, explore the opportunities to prescribe naloxone or other harm reduction supplies. A lot of times, folks who have health insurance can get naloxone paid for completely by health insurance, and then they're getting the nasal naloxone. So if you are prescribing some of these supplies to someone, that takes away a financial barrier for them in accessing it. Make sure the pharmacies in your area are willing to sell syringes to people who ask. So, and you can also check to see if pharmacies or medical clinics in your area accept biohazard or use syringes from folks. I think that syringe disposal is a huge need in our state. We have a lot of people who will present to our needle exchange that are using insulin syringes and don't have anywhere to dispose of them because, you know, pharmacies charge a $5 fee to dispose. And for some people who are on a fixed income, $5, even once or twice a month, is outside of their budget. And so I think looking at our community, at the infrastructure that already exists, and seeing how can we utilize this infrastructure or these financial programs to make sure that they're more inclusive, make sure we're meeting the needs of people who use drugs in our community. And the next point is developing policy and procedure, which is a sticking point for a lot of organizations. The good news is that there's already a lot of work done in this area, and usually one of us that have a program already can give you something to start with. So I strongly encourage you to reach out and ask programs near you, reach out to me. There's no need to reinvent the wheel. So if I don't have the specific policy or procedure or workflow that you would need, I might know someone that does. And sometimes just seeing how another program or clinic has integrated things can spark the creativity of how to do it in your own context. So on to the next point, which is generating community buy-in and addressing opposition. This can be a big challenge. It can be very political. Not going to sugarcoat that. It depends on where you live. You might have big stakeholders that are super harm reduction and people who are super not. So the thing that I want to emphasize is that people who use substances experience stigma and shame every single day. So research and case study evidence the positive impact of harm reduction on health outcomes. So we want to break away the stigma that exists around substance use. If we don't all acknowledge that there are people who are using drugs in our workplaces, in our communities, in our practice, then we're not going to be able to get to the real conversations about what the needs are. And you got to acknowledge too that you're never going to win over every single person to this approach. But sometimes groups that do start out opposed to harm reduction end up turning into your biggest advocates once they receive some more information and can understand the approach a little bit more. So I have an example of that is that here in Portland, my coworker and I have implemented doing presentations to the Portland Police Bureau. Every single year, we go around to all of the roll calls, which is at the start of every shift, the officers gather to go over the day. And we show up and we give a 7 to 10 minute presentation on our service data, what we're doing, our approaches, and like our shared goal to increase community safety. And we don't win over every single police officer, but we do feel that by being really transparent about our program data, sharing with them drug use trends that we're seeing, helping them understand and see what supplies we're giving out there, how much biohazard we're collecting. It has helped foster a relationship that has ultimately created better interactions for our population out in the community. Because once those law enforcement folks have a better idea of what we're doing, when they see one of our clients with a sharps container, they understand now that like this person is trying to do the right thing by making sure these syringes are disposed of safely. And to us, that's really the end goal, is helping reduce that tension that often exists between our program participants and law enforcement in our community. Additionally, to create that community buy-in, we also provide various trainings to community organizations or community groups, student groups, and one of those is called kind of a Harm Reduction 101, which just demystifies some of the aspects of substance use for people in the community who have fear or judgment towards people who inject drugs. You know, we all grow up saturated in a lot of information and assumptions about what someone who injects drugs looks like or behaves like. And being able to have just honest conversations with some community members about that to break down some of those, you know, myths that might exist. And the other training that we offer is a naloxone Train the Trainer. And this course helps organizations get naloxone integrated into their sites, or can help programs start planning for naloxone distribution. Within our metro area, so really Multnomah County, Washington County, and Clackamas County, we will offer participation in a purchasing program through our Multnomah County Health Department pharmacy. And anyone who is from a community-based organization in this tri-county area that participates in our Train the Trainer course can then get Narcan at cost from our county pharmacy. The nasal Narcan is still about $75 a box, which is 2 doses, but that's significantly cheaper than over the counter, which at a retail pharmacy, which can go from $150 to $160. And the benefit to community-based organizations in our area who participate in our program is that they do not then have to have a licensed medical prescriber in their organization to access this prescription medication. Our pharmacist and our health officer for Multnomah County authorize that prescription, and the group then works with me to place new orders whenever they need it. And you know, they will provide me then with overdose reversal reports for any time that their Narcan they've received through our purchasing program has been used. What I've noticed in the last few years is this outreach and engagement and doing these presentations is a really effective way of reducing stigma, increasing knowledge and understanding in the community. And it can be really rewarding because you know then everyone that you involve in these trainings is then going back to their own networks and the people they serve, hopefully with new tools and new information to improve services in our area. The last slide I'm going to leave you with today is sort of a charge. What can you do today? And that is really to begin to build trust and engagement with people who use drugs. We all know and serve people who use drugs, and if you don't think you do, it's likely because people who use drugs don't feel comfortable or safe telling you that they're using drugs. So you want to build trust, and to do that, you need to get comfortable talking about drug use without judgment or stigmatizing language. This includes your tone of voice and your body language. You need to disclose what you are going to do with any information that you take from people, including how any information might be documented in their electronic health record. This is a big thing that we have learned and come up with in operating our harm reduction clinic, because we do use Epic. Initially, when we started the clinic, we did all of our charting on paper. We opened the clinic 5 years ago, February, 5 years ago. And I really loved the paper charting system because people felt safe knowing that it was just going into a chart and wouldn't be potentially accessible. People are really afraid when they come into our clinic to, get services for abscess care or anything that could be seen by other providers that they have, because they don't want to be outed as a drug user. So we have to be really mindful in how we do our notes. Any information that we collect, we're very transparent with folks about what we're putting in their chart and why, and making sure that it's medically necessary to be in their chart. The next point really is to respect bodily autonomy and practice meeting people where they're at in their life. Sobriety may not be the goal or even be an obtainable goal right away for a lot of people. So we always prioritize asking people what their goals are or what their immediate needs are and how we can support them in meeting those goals. There's a lot of motivational interviewing that our team does with people to help our participants, maybe break down those big goals into the short-term achievable goals. And what we want to see is any positive change, right? To help someone live their best, happiest life, whatever that looks like. The next point is really to learn about the resources that already exist in your community and how you can connect people that you're working with to culturally appropriate services in their community. And this is how you can start to also identify the gaps in your community and fine-tune where your efforts should be focused to develop new resources, develop something that doesn't already exist, because there might be a resource that's really robust and already exists, and there's no need to reinvent it if that person would be best served from that resource. Learn how to connect them there with a warm handoff and make them feel safe accessing that service. It's also important to advocate within your system for the health and wellness of people who use drugs. And an important element to this is to consider all of the intersectional identities that people have and how those identities can increase health and safety or decrease, health, safety, and in all of those psychological, racial, economic, physical health. All of these things for people they're bringing to the table, whether they're parenting or a caretaker of someone, if they have employment, all of this is going through someone's mind as they're making that mental calculus of what to ask for, what to say to you. And I think that's why all of the things I've said above are really important to consider as you look within your own agency or organization or practice, and say, how can we advocate to make people feel safer, bringing their authentic self and bringing their authentic needs to us here so that we can help improve their health. And where you can, break down barriers. You want to ensure that your patients or your clients have access to these supplies that they need to keep themselves safe. And sterile syringes, naloxone, wound care supplies, safer sex supplies, all of these things are a tangible material that you can give to someone that empowers them to keep themselves healthy, to keep themselves safe. And by handing them that supply, you're building trust, because you're saying here, I want to keep you safe. You needing this isn't going to change our relationship. And where you can, I always emphasize integrating services or supply access into your system. If you're a provider, integrate medication-supported recovery prescribing, integrate naloxone co-prescribing, provide even just a small amount of sterile syringes or wound care supplies in your building, like right alongside, safer sex supplies. Make sure that your pharmacies provide Narcan and sterile syringes to any adult that asks for them. Support free syringe disposal at any location that is already generating biohazardous waste. Is there a way to integrate, ways for people to dispose of their supplies safely, so that there isn't as much syringe litter and there isn't as much stigma about having a used syringe on you. And I think that all of these little changes can make spaces feel safer and more welcoming to people who use drugs. So to wrap up, I want you all to please remember that the program I'm operating in is really large. We're moving large amounts of supplies. We've been doing this for decades. If you're just starting something, your budget's not going to look like mine. Your operations won't be this big at first. You need to plan that if you're starting something new, it's going to be slow for the first year. People need to have time to build trust with your organization. The word of mouth information that you're a safe place will eventually spread. Our harm reduction clinic was super slow when we first opened it 5 years ago. And now it is one of our busy sites, and it has grown more than any of our other sites in the last 5 years. And that's because eventually people realized that accessing medical care there and accessing needle exchange there was safe and warm and welcoming, and they told their friends, and now everyone comes there and wants to hang out. And so just plan for that, plan for it to be slow, focus on engaging a few people and support them to spread the word of your resources. And you may want to even offer incentives initially to people that you have relationships with. We've done gift cards or candy or different things like that to help support our participants in spreading the word and getting information out to other people. Just remember that because of stigma and fear of judgment and the real world potential consequences of other people finding out that you use drugs, people often have a very real hesitancy to engage with new people and new programs. And people have long histories of experiences that they carry in that causes a lot of distrust in service providers. And we want to be thoughtful about the type of services that we integrate and the programs that we establish to make sure that we're focusing on quality. And once the community knows that you can be trusted, they will feel safe getting those resources from you. So that's all I'm going to say today. Please reach out to me for any support in the future. And thank you for your time and attention today.